to generate more resources to help the education sector. So these are the approaches that I would do if I were to embark and assume the position of Chief Executive of the province. Thank you.
Thank you so much, Governor and Mr. Tavis. This is now our second issue.
Sa yung maayon ninyong mabuhat para mapaspas ang pag-release sama sa mga calamity fund nga kanang madali-dali pud nga dili pud igo pong madunot ang balay or arimis payag magpuyo ang amo ra untang gihangyo nga kanang madali-dali ra pag-release sa calamity fund.
For 2 years in a row, it seemed like disasters have frequently been visiting the province. In December 2011, Negros Oriental was struck by Bagyong Sendong, killing 38 and leaving almost 10,000 homeless. In February 2012, another catastrophe shook Negros Oriental with a magnitude 6.9 earthquake, putting an end to 52 lives, leaving collapsed infrastructures, and displacing hundreds of families. In December 2012, Typhoon Pablo brought strong winds and rainfalls. A year after these major disasters, other Negrenses seem to be left hanging in the dark.
To first discuss his plans on disaster risk reduction and management, let us welcome, once again, Governor Well Digamo.
Again, good afternoon. It is not a question of how, but what we have done in the province of Negros Oriental insofar as the preparation on the disaster management is concerned. First, on the preparation, the only province in Region 7 that formulated a 5-year disaster risk reduction and management plan that qualified Negros Oriental for the first level of the DILG Seal of Disaster Preparedness. The plan contains programs, projects, and activities. Letter A, awareness campaign, information dissemination, various trainings, search and rescue, scuba, bantay pesti, seminar workshops, production of IECs, construction of river dikes, massive reforestation, purchase of heavy equipments, life-saving equipment, coordination with various stakeholders, LGUs, private sectors, national government agencies. We also entered into an agreement with German International Cooperation for the establishment of a local flood early warning system covering Banica and Ocoee River. Partnered with Energy Development Corporation for rainfall reading through rain gauges installed in Valencia watershed areas. For Sindong victims, immediately after Sindong, I requested 961 million for rehabilitation of damaged infrastructure projects. I am happy that the President answered our request, President Pinoy, nga ang 480 million nisulod sa ato ang panudlanan. Ako na yung gisugdan ang pagpa-implementar, but sad to say, nga naay politiko nga naghawid nga ipabalik ang mga pundo para dili nato mapadayon ang atong proyekto. If you will notice, naatay na sugdan diha nga pila lamang ka porsyento sa 480 million. Allocated an amount of 150 million as river control projects along Banica River. Kay gusto na akong maprotektahan ang kinabuhi o propiedad sa katawhan sa Dumaguete City, sa Sibulan, o sa ubang parte nga naigo sa Bagyong Sindong. On top of the 43 million river control projects using our local funds. Extended financial assistance to victims with damaged houses, which totaled to 15 million pesos. Extended some 18.3 million cost of assistance, food and non-food items. For earthquake victims, submitted strategic action plan amounting to 1.2 billion to NEDA for the rehabilitation of damaged infrastructures due to the magnitude 6.9 earthquake. Had delivered some 62 million worth of assistance from the provincial government in various forms such as food and non-food items to about 60,000 affected families of 219,923 total number of persons. conducted immediate clearing operations to roads leading to essential facilities such as the community primary hospitals, blocked by the debris caused by the earthquake-induced landslide. Immediately implemented rehabilitation of portions of Gihulngan District Hospital damaged by earthquake. Extended financial assistance to families of victims of landslide in Barangay Planas, Gihulngan. Burial assistance of 3,000 per victim. Conducted series of medical missions in affected areas. Sulongon, La Libertad, and Planas, Gihulngan, among others. Set aside 1 million pesos for the construction of temporary shelters for victims in Barangay Sulongon. Mga kaigsunan, mao kanay gihimo sa ato ang kagamhanang probinsyal nga pag-abot sa bagyong Pablo, wala gyoy daghan nga casualties nga miabot tungod kay napreparar nato ang probinsya. Daghang salamat.
Daghang salamat, Governor. To share his own opinions on the matter, let us welcome Mr. Gary Teves.
We learned from experience. In the case of the devastating one that we had in 2009, this was, of course, in Pangasinan. The former president organized the public-private sector national commission. So we learned from that experience that the private sector to work with us very closely in immediately identifying what happened and as well as determining the extent of the damage. We brought in our experts in government as well as international ones, and we immediately came up with the information and data on how much we need for the entire country, especially in the areas where Sendong, Ondoy, and the other devastated areas. What really happened was that we were able to gradually get support from international institutions as well as our own. The same manner could be done here. We have to work together, the province, the LGUs, together with the local agencies. This has been done, and there's an improvement as evidenced by the latest Typhoon Pablo, where the mayor of Dumaguete really prepared himself together with his group. So that is the approach that we need to do. At the level of the people, the most important is to save lives. So we have to make sure that we have to have a relocation center for them. We have to identify where these are and make sure that there are facilities as well as the wherewithal to put them. Make sure they're out of the river banks, because that is really an area that's really very, very dangerous. We need to plant bamboos along these river banks to serve as a deterrent. So we also can generate some support from local government units which have calamity funds that can support whatever calamity funds we have in the province as well as in the city, if we're talking of Dumaguete City. So the key is cooperation, dedication, and quick response. There are three components. One is relief, two is rehabilitation, and three, reconstruction. So we have to have a plan for both. The relief, of course, is quick. We have to identify people and institutions that can provide food, water, and then we need to generate resources from the national government and local governments for the rehabilitation work, and finally, the reconstruction work. With that, plus constant communication, constant monitoring, we will be able to do better and better in the next few years. Thank you.
Daghang salamat, Mr. Teves. Ladies and gentlemen, this is our third issue.
Unsay proyekto ninyo alang sa mga kabus nga nagkinahanglan og tambal alang sa serbisyo medikal?
Health is wealth, but this wealth is rather out of reach for many. The total number of dengue cases in Negros Oriental in 2012 skyrocketed to almost 500%, with 2,547 cases compared to the 467 cases of 2011. 8 fatalities were recorded last year. Malnutrition is also a big issue since more than 1,000 children in the province are still underweight. In fact, in the year 2010, Negros Oriental marked the highest malnutrition rate in Central Visayas with 11.31%. Several other patients are still in line, hoping to receive financial aid from the government.
How will you make health programs more accessible to the people of Negros Oriental? Health is wealth. How are they gonna make Negros Oriental wealthier? Let's start with Governor Ruel Digamo.
When I started as governor, I immediately set a flagship program of government dubbed as Sa Provinsya Magdigamo Ta. Health gets the lion's share of our annual budget. The provincial government takes care of both preventive and curative aspects. Improve the 6 community primary and 6 district hospitals of the province of Negros Oriental. I challenge everyone nga kung makasuroy kamo sa tibuok probinsya, tanawan ninyo ang tanang hospitals nato kay aduna tay mga improvements nga gipahimutan karon. Constructed the 7th community primary hospital in Barangay Dawis, Bayawan City. Akong gibutangan og bag-ong hospital ang Bayawan City to cater for LGUs in the province of Negros Oriental. Bae City, Tanhay City, Mabinay, and Bayawan City. Improve supports infrastructure such as roads and bridges leading to these hospitals. Nakita ninyo nga ang mga bag-ong equipment sa probinsya tuwa karon sa mga kabukiran kay akong gipaayo sa mga kadalanan, labi na sa mga kadalanan paingon ngadto sa mga hospitals. Bringing health services at the doorstep of the people through the Magdigamo Surgical Mobile Team. A team of doctors, nurses nga atong dadon ngadto sa mga kabarangayan aron mokudak og minor and major surgical services. Kaya nakabalo ko ugon sa kalisod ang mga tao dito sa kabukiran, kay sige kong adto sa mga kabukiran. Added doctors and nurses in community primary and district hospitals. Farm out doctors who are products of our scholarship program for medicine. In addition, I have already approved allocation amounting to 10 million pesos for the purchase of a mobile clinic or mobile hospital. Kay gusto nako ang mga kabarangayan abton gayon nako ang serbisyo panglawas kay mao kanay gikinahanglan sa atong mga katawhan. The provincial government also enter partnership with PCSO by providing the agency with a local office in the province. Naa na karoy opisina ang atong PCSO aron makahatag dayon directly sa lokal ang PCSO kay kasagmitan natong pagabuhaton mo request pata sa national government nga mokustar og dugay kayong panahon nga mo suffer ang ato ang mga katawhan. In our anti-dengue campaign, additional budget allocation for 2012, 500,000. Ako ning gisalig sa ato ang mga doctors kay mao sila man ang nakabalo kung unsay mga mitigations kay ilang pagabuhaton. For 2013, I increased the budget to 5 million pesos para gyud nato ma-eradicate ang dengue kay mao kini ako nakita nga dako kayo nga problema para kung mutukar ang ato ang mga kaning mga lamok nga susama niini. Regarding the malnutrition, we have brought down malnutrition rate gikan sa 2009 11.2%, 2010 8.4%, 2011 8.1%, and 2012 7.1%. And if this will continue, because I will remain focused for this problem. Partnered with UNICEF, DOH for the Garantisadong Pambata Program for the warming of children, provision of vitamin A, iron, and other micronutrient supplements. Target beneficiaries, 200,000 preschool children. We also provided fresh milk feeding program for the malnourished children, are giving free milk supplements for a total of 120 days. Ladies and gentlemen, mao kini atong gihimo sa kagamahanang probinsyal.
Daghang salamat, Governor. Let's now hear how Mr. Gary Teves will make us wealthier.
I will try to ask our provincial group, the Vice Governor and the board members, to see whether we can increase our allocation for medical needs, hospitals, and the like. I will probably tap the resources of the Department of Health as well as PhilHealth. Recently, the government has seen the approval of the sin taxes. I indicated earlier that would generate the first year 34 billion up to the fifth year close to 500 billion, and this will be used to improve the facilities of our hospitals as well as provide doctors, nurses, and medicines. I would tap the facilities of the Philippine Charities Sweepstakes I will encourage the continuance of various health programs like PhilHealth, Pino, and PESO. And like the governor, I will try to revive the school feeding program that was initiated by my father, and also ask the help of the Department of Education and the Department of Health. There are also various institutions, such as the San Miguel Foundation, that we can tap, which are engaged in providing support for the school feeding program. In the conditional cash transfer, I would probably request the national government to provide greater allocation for health-related needs of our countrymen. I will also encourage our congressmen and the local government units to co-finance these funding of our higher level of support for health-related concerns. Thank you.
Thank you very much, Mr. Cavez. Negros Oriental, this is our last issue.
How are you going to attract fresh graduates to stay and work here in our province? What possible jobs can you offer?
Based on the 2012 statistics, there are approximately 2.8 million Filipinos who remain unemployed. 6 out of 10 of these unemployed are males belonging to the 15 to 24 years age group. Across educational groups, 1/3 of the unemployed persons are high school graduates, 1/8 are college undergraduates, while 1/5 are college graduates. Other Negrenses are left with no choice. Either they try their luck in a foreign country or in bigger cities such as Manila and Cebu, or the rest settle for jobs which they are usually underpaid.
What is your solution to the growing number of unemployed or underemployed citizens in Negros Oriental? Should we rehire him again? Ladies and gentlemen, Governor Ruel Digamo.
As of today, the NSO wala pa mohatag na ko og datas on the number of both the unemployed and underemployed. And let me also emphasize that the provincial government is not an employment agency.